Hello, Professor Goudard. I'm glad to meet you today to speak about circus on behalf of Italian Interdisciplinary Center for Performing Arts Medicine. I remind that you are not only a doctor and a researcher in performing arts, but also a complete artist. Actually, you're an actor, a producer, and a circus artist. Recently, you directed the first international convention on circus, a circus week in Montpellier, France, which talked about circus and literature, circus and education sciences, circus and performing arts, and finally, circus and performing arts medicine. Doctor, what are the first results of the circus week?
Oh, they are excellent, because we had, and we are very happy of that, because we had more than 3,000 people who had assist to the conferences, lectures, shows, performance, and films, and in them a lot of students and artists, and there they had meet specialists and researchers about literature as well as performing arts and performing art medicine, and so we are very happy to have so much people in the audience.
The circus medicine is a field where you are, at an international level, a particular representative. Please, what are the most frequent pathologies to prevent, and which ones need to be treated?
So circus, is a very dangerous trade. That's the first point. And we can observe in that field some accidents, wounds, and medical pathology. About accidents, we have falling from heights, falling headlong, and shocks, and fall of objects, and the wounds are related to regress supraphysiological, and but also from direct falls, shocks, and repeated contacts. They are frequent in circus, with several episodes per annum, depending to the studies, and pathology is mainly osteoarticular one, 90%. It touches by order of appearance lower limb, upper limb, and rashes, and articulations are particularly at risk by decreasing frequency. We have shoulder, knees, ankle, wrist, and intervertebral too. One finds all the types of pathology of the locomotor apparatus in circus, and medical pathology is mostly otorhinolaryngology and pneumo infections. In the means that when you practice circus, there is a fall of immunizing defenses, and in the times of overdrives very often. The addiction can be seen, tobacco, cannabis, alcohol, and to be exposed to the physical agent is well known too, or chemical one. You have, for example, high-level sound, sawdust, dust, hair, or makeup, or petrol, or smoke, or such things, or to specific hardware or materials that produces medical pathology. There is a physical strain and psychic too, and a degradation of the medical and social conditions, and it is very often quoted and mentioned by artists during their professional past. And we have shown too that the appearance of pathology is under the influence of several determinants or worsening factors. The principal determinants of apparition of pathology is to practice the circus itself. It's the first thing. And we have shown how the practice itself is a leading cause of appearance of pathology during the professional training, and that is impossible to practice high-level circus without being wounded. It is a principal determinant as of the training and during the professional exercise. And the pathology related to the practice itself is conditioned by several worsening factors, as medical and surgical antecedents, because they all repeat, it's sure. Age increase the frequency of the wounds about after 24 years. Certain disciplines, as acrobatics and aerial disciplines, are more traumatizing, and increase of technical level increases the apparition of pathology itself. But to be a woman or a man has no influence. Works conditions are another determinant, because performances of the artists are comparable with those of athletes, but daily practice of the trade expose them to many occupational hazards, aesthetic constraints, condition of operating, the shows, periodicity of work, plurality of tasks, coactivity, relational question, animal proximity, for example, specific frame of mind is to be quoted too, and medical defect of follow-up, and to economic and social precariousness. And the professional past of the circus cause a physical and a psychic strain too. And economic and social risks have to be considered as worsening factors. And that's about pathology, okay, in circus. And you asked me which ones need to be treated, and all those problems, in fact, need to be treated, of course. The treatment has often no specificities. If you have to treat an allergy or ankle distortion in a circus artist, there is not special method in circus, okay? But what is very special, what has to be considered is the context of exercise. You cannot treat a circus artist as she is a secretary, you know, and this is why the therapist must absolutely know the works condition of artists.
What are the healthcare professionals that are involved, and how do they proceed?
All the therapists in a lot of specialties are useful for the treatment and prevention in medical approach for circus artists. All the therapeutic approaches, including medicine known as alternative in French, can be used with profit to come to assistance to the circus artists. But they have to adapt to the context of the activities. That's the main point. And I remember that in Agrigento in 2009, Professor Dafoussi says the performer requests of the assistance to the physician not only for his health, but also for his profession, his artistic future, and his aesthetic choice. That position is very, very clever, very important to be considered. And the relation existing between the therapist and the artist is really essential. The precision of the diagnostic is very important too, and essential in circus. And rehabilitation and readjustment have to be specific, because the artist must be sure to be wounded when they practice the circus at high level. So the medical prevention is essential. About prevention, we have proposed a 12-point path, which could be a good pattern for medical approach of prevention in circus health. And I can give you the 12 points just quickly now. Regards of contraindications to the practice, prevention of the accidents, prevention of the wound, prevention of the stress, because it can be obtained, prevention of pain by the improvement of works conditions. We have to look about the training of the artists. We have to inform them and the professionals of the sectors, because it's very important that they know the specificities of that approach. We have a specific medical approach to to consider, which is necessary. We have to use specific care channels to operate for the circus artists, and we have to develop several specific research programs. And one thing which is very important too is to look to the accompaniment of the end of professional exercise for the artist, because there is a lot of very bad condition when they stop very often, and in order to break insulation for them, because they are very often alone with their specific medical problems.
The Circus Week. Are you thinking on a second edition? And can you say us some previews?
Oh yes, of course, and we would like to organize it in next 2013. And our goal clearly is to become the most important international meeting point for every type of researcher and specialist, whether it is in history, literature, performing arts, education, and of course performing arts medicine. And I hope that the collaboration between il Centro Interdisciplinare di Medicina dell'Arte and our university, which began 3 years ago through an invitation of Professor Guiccardo, will be stronger, and that we will work together to propose that project for the wellness of the circus artist. Really, I hope that.
Thank you, Professor Goudard, for this interview, and goodbye.
Thank you to you.